AIDS epidemic, people would say, yeah, well, these, it's mostly gays and it's tragic and it's sad, but they're gays and it's sexual lifestyle and all that. And it's sort of this thing about minimizing the suffering of the victim. And you see this all the time where, let's say somebody dies of lung cancer. And the first question, oh, was he a smoker? Yeah, he was a smoker. Well, it's too bad he died, but, maybe he kind of deserved it. Not really deserved it, but it's understandable. No, it doesn't deserve the amount of empathy that a non-smoker would get. And it's almost the same thing with someone who dies of COVID. The first question people ask is, was he vaccinated?
Were they
vaccinated? Well, the guy's so stupid. You're not saying that, but you're almost thinking that. Well, not that he deserved it, but that we have a way of minimizing the tragedy of one's illness.
That is such an important point, and I'm going to throw another category where this applies to too, is my patients who I've worked with primarily over the years were people with diabetes, and specifically people with chronic wounds that have led to amputation and a whole host of comorbidities. Yeah. And it shocks me, and it's just so, I know, mind-numbing when you hear people's attitudes like, well, they're diabetic, they did it to themselves.
Yeah.
It's like, no, they didn't.
Yeah.
They did no such thing.
Yeah.
And it just, and your example, Scott, it's spot on. Yeah. Now we've got people, well, they didn't get the vaccine. Well, it's like, no, that has nothing really to do with this. It really doesn't.
Yeah. I mean, it's still a father that may have lost a son that lost a father, a husband that lost a wife, a lifetime that's gone.
Exactly. And, and again, to the point of the vaccines, look, people that have gotten the vaccines are dying from it. We know this. So you can't minimize the suffering of others. This is, and I think maybe the bigger point of all this is what you alluded to again, is empathy. Why would we just say, oh, it's almost like, well, it didn't happen to me, so the heck with it. Good luck to you. And I think that's more of an attitude, and maybe part of the sign of the times. Randy talked about back in the 40s, people jumped to the service of their country, mm-hmm. and looked at others before themselves, maybe. And now we've kind of turned it inside out. I think it's all about me, and it has been for quite some time. And this is a disturbing thing too. How do we get back to this point where we try and lift each other up? We look to be there for each other. This is why we're all here. I always say this. We're all just passing through. Our responsibility, yeah, we have to take care of ourselves, but really we take care of ourselves so we can take care of those around us. And there's going to come a point where we're going to be on the receiving end of that. And hopefully we'll have some compassionate people surrounding us who will, carry the torch. I think this is such an important concept.
One of the things that's different now than it was in my early career is when I was, just first working with AIDS patients is I didn't have the internet, and I didn't have armchair experts. And I didn't have neighbors my neighbor's cousin's sister is a nurse, or, my best friend's a pharmacist, and here's what they all have to say. And the water has become muddier and muddier and muddier we're at a point, we're in a frenzy. Economically, we've been shut down. We've been told not to go out. Don't get anywhere closer than 12 feet apart from each other practically. So there's already this heightened anxiety and sensitivity. You're looking for answers because that's human. That's what you do as a human. You try to find answers, and you're getting a multitude of answers on this thing called the internet. And none of them are validated. And so you're at a point where you can't really tell What's truth? Who should I trust? What do I do? So we've kind of created this stew in the way we approached it as well. I didn't have that back in the early 80s when I was just first starting my nursing career. Yeah, I was concerned, scared to death of needle sticks, but never once did I think, do I go in and help that person? Of course I do. That's my job. That's what I do. I wasn't sure. I mean, we were still, think about this, back in the early 80s, we were still trying to figure out how it was transmitted. Yes, we talked a little bit about how there was a segment of the population that it was greatly impactful to, and that is the homosexual population. But guess how surprised we all were when it was like, uh-oh, here's a heterosexual. Where'd they get it? It was through blood transfusions, and then, we have young children who are getting it. And it's like, what happened here? So it was kind of the same situation in that we also didn't know, but I didn't have in my hand every day this constant barragement of second guessing and what I've now lovingly called armchair experts. That aren't
Double-edged sword.
experts.
Yeah, we have access to information that we did not have years ago. I always say, man, I can imagine going to college and being able to do a research paper or something from your dorm room or from another setting because you have access to all this information versus having to go to the library and go through the card catalog and the research library and all those things. But it's that double-edged sword, what I say, because it's not information, but what we have now is a huge game of telephone going on. It's like the party game. The message starts with one thing, and 5 people around the room, the whole message is already distorted. And I think what we have is a game of telephone that's going on a scale that we've never seen the likes of. This is part of the issue too.
I'm going to offer
misinformation to go with information.
I'm going to offer at some risk. I know it's probably not a good idea to talk too much about things that are personal, but I am going to offer this because of exactly what you're talking about, or what we're talking about here. In 1993, I made the seemingly ridiculous decision to leave a very successful practice in Clearwater, Florida, and move back home to Alabama. And in those early days of that new practice, I was not very busy. And an internist that I know asked me to see a patient of his who had AIDS. He also had Burkitt's lymphoma, and he had a bowel obstruction because of it. Pardon me. And this particular internist asked me to go and see him, and I was really flattered. He said, I have a feeling that you might be the only surgeon on the staff that's willing to go in and potentially operate on somebody with HIV. But to advance the story, I did have some time on my hands, and I had no reason to rush the conversation, and I sat and listened to him for a couple of hours. I learned a lot about the pathophysiology of HIV. I learned a lot about the reality of homosexuality, and that it is not a personal choice that somebody makes, that they are born that way. I learned lots and lots and lots. I was able to finally persuade that man to have the operation that he needed. And he had another year and a half or so of pretty good life because we were able to go ahead with that intervention. But what I'm trying to get at here is that thing about listening. I mean, that could cure a lot of what's going on here. And the problem is, in this environment, what Rhonda has brought up, we don't actually listen to people on an individual basis. We listen to this tidal wave of nonsense that spews at us through media platforms that are all promoting any number of products. So it's been filtered. You know, it's not honest conversation. It's been controlled by advertising companies and so forth. We see teenagers wandering around with their faces in a screen, doing anything but having a face-to-face conversation. So the change in the way that human beings have interacted with each other over the past hundreds of centuries has changed in a way that I don't think anybody could have ever visualized, and it's having an effect. It is really having an effect. The novelty of having a respectful conversation and listening to each other has essentially disappeared, and that is no more apparent than in the halls of our government. You know, these guys get in congressional committees, and rather than asking questions of witnesses and trying to enlarge their own store of information, they're just campaigning for the next election.